Welcome back to Eerie Insights. Today, we're diving into the microscopic world to uncover the top 10 deadliest bacteria. These tiny killers are responsible for some of the most devastating diseases known to humanity. Let's explore their deadly secrets. Kicking off our list at number 10 is Vibrio cholerae, the bacteria responsible for cholera. This waterborne pathogen thrives in contaminated water and food, leading to severe diarrhea and dehydration. Cholera can cause death within hours if left untreated. Outbreaks are common in regions with poor sanitation and limited access to clean drinking water. Vibrio cholerae produces a toxin that triggers the intestines to release large amounts of water, resulting in rapid dehydration. The key to fighting cholera lies in rehydration therapy and improving water and sanitation infrastructure. With proper treatment, the mortality rate drops significantly. At number 9, we have Neisseria meningitidis, the cause of bacterial meningitis. This deadly bacterium infects the protective membranes covering the brain and spinal cord, leading to severe brain damage and a high mortality rate if not treated promptly. Symptoms include sudden fever, headache, stiff neck, and sensitivity to light. Neisseria meningitidis spreads through respiratory droplets and close contact. Rapid medical intervention with antibiotics is crucial to prevent severe outcomes. Vaccination has proven effective in controlling outbreaks, particularly in high-risk populations. Number 8 is Mycobacterium tuberculosis, the bacterium behind tuberculosis, or TB. This airborne pathogen primarily attacks the lungs but can spread to other parts of the body. Despite advances in medicine, TB remains a major global health threat, causing over 1 million deaths each year. TB spreads through the air when an infected person coughs or sneezes. Symptoms include a persistent cough, chest pain, and weight loss. The treatment for TB involves a long course of antibiotics, but drug-resistant strains are emerging, complicating efforts to control the disease. Number 7, Yersinia pestis. Infamous for causing the Black Death in the 14th century, this bacterium, spread by fleas, led to the deaths of millions and still causes occasional outbreaks of plague today. There are 3 forms of plague: bubonic, septicemic, and pneumonic. Bubonic plague, the most common form, causes swollen lymph nodes, fever, and chills. Without treatment, the bacteria can spread to the bloodstream and lungs, leading to septicemic and pneumonic plague, both of which are often fatal. Antibiotics can treat plague, but early diagnosis is critical. Number 6, Pseudomonas aeruginosa. This bacterium is a common cause of hospital-acquired infections. Resistant to many antibiotics, it can cause severe infections in the lungs, blood, and other parts of the body, particularly in immunocompromised patients. Pseudomonas aeruginosa is notorious for forming biofilms, which are protective layers that make it difficult for antibiotics to penetrate. This resilience makes infections challenging to treat and emphasizes the importance of infection control measures in healthcare settings. Number 5. Clostridium botulinum. The producer of botulinum toxin, one of the most potent toxins known. This bacterium causes botulism, a rare but potentially fatal illness leading to paralysis and respiratory failure if not treated quickly. Botulinum toxin blocks nerve functions, leading to muscle paralysis. Botulism can occur through contaminated food, wounds, or even from certain medical treatments if not properly handled. Antitoxins and supportive care are crucial for recovery. At number 4, Staphylococcus aureus, particularly the methicillin-resistant strains known as MRSA. These bacteria cause a range of infections from minor skin conditions to life-threatening sepsis, and their antibiotic resistance makes them a serious public health concern. MRSA is resistant to several commonly used antibiotics, complicating treatment. Good hygiene practices, proper wound care, and responsible antibiotic use are essential to prevent and control MRSA infections. Number 3 is Salmonella enterica, a leading cause of foodborne illness. This bacterium can cause severe gastroenteritis, leading to dehydration and even death, especially in vulnerable populations such as young children and the elderly. Salmonella spreads through contaminated food and water, often linked to raw or undercooked meat, eggs, and dairy products. Proper food handling, cooking, and hygiene are key to preventing salmonella infections. At number 2, Escherichia coli, particularly the O157 strain. This pathogen is notorious for causing severe foodborne illness outbreaks, leading to bloody diarrhea, kidney failure, and even death in severe cases. E. coli O157 produces a powerful toxin that damages the lining of the intestine. Contaminated food and water are common sources of infection. Vigilant food safety practices and prompt medical attention are crucial for managing outbreaks. And finally, at number 1, Bacillus anthracis, the bacterium responsible for anthrax. This deadly pathogen can be contracted through the skin, lungs, or digestive system, leading to severe illness and often death if not treated immediately. Its potential use as a biological weapon makes it particularly feared. Anthrax can manifest in different forms, including cutaneous, inhalation, and gastrointestinal anthrax. Inhalation anthrax is the most deadly, causing severe respiratory distress. Antibiotics and vaccines are effective against anthrax, but early detection and treatment are vital. These deadly bacteria remind us of the unseen dangers lurking in our world. Awareness, hygiene, and medical advancements are our best defenses against these microscopic killers. If you found this video insightful, please like, share, and subscribe for more eerie insights.